What happens when the patient gets a mammogram, the radiologist always looks at it to sort of determine, as part of the report, they will mention whether the patient is fatty. We kind of divide it up into 4 different densities, so they can either be fatty, have scattered tissue, have moderate amount of tissue, or have a lot of tissue, which we call extremely dense. And so that'll almost always be part of our report to the referring physician. The patient's lay letter doesn't usually go into that much detail. We just tell them everything's fine, we'll see you in a year. So if the patient wants to know whether they're dense or not, you really can't tell by physical exam, because I've noticed just in my own practice that sometimes the people that have the fatty breasts, which we love to see that on our mammograms because it's really easy to look for things in that type of breast, their breast may feel really lumpy. And then the people that have the really dense breast tissue, their breasts may not feel lumpy at all. So I don't think physical exam is a really good way to determine that. The patients, obviously, they could talk to their referring physician, get a copy of their official radiology report. That's available to them. They can ask the radiologist. I'm always happy to go over the patient's imaging with them, and we can point out to them what we mean by dense breast and let them know. So I do think it's information that can be helpful to the patient, because the more dense the breast tissue is, 2 things kind of come into play. One is it's harder to look for cancer in a dense breast. It's not impossible, so I definitely tell people you still need mammograms, but it's going to be a little bit more difficult to detect breast cancer. And in the last few years, they've actually identified that it is a risk factor for developing breast cancer. So people with dense breasts may have an increased risk for developing breast cancer. So there's a couple reasons to know about it.